Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue telehealth practice to help chronic pain sufferers to live pain-free or painless and enjoy their lives. Today we have a guest. I'm real excited, Dr. Sarah Merritt of Lifestream Health. She is also a pain management specialist, although she does a lot more with interventions, which we want to get into today. So welcome, Dr. Merritt.
Thank you. Thanks for having me.
Yeah, this is real exciting. So I know there are a lot of different types of interventions, injections, nerve blocks, different things that people can get. Who's your ideal client? Who's the person that should come see you to get help?
Gosh, yeah, any patient that struggled with an issue, a painful issue for any length of time. Gosh, there are times we see patients with acute pain right after an injury or car accident. So there are times that we see patients within a week or two of a car accident if they're having pain. Most commonly, really most of our patients are people who have had pain for more than 3 months. And so, like medically, in terms of the definition of chronic pain, we talk about pain as being ongoing and chronicified, chronic in the body if it's gone on for more than 90 days.
Right. And
we see patients with, I guess, to interject, we see patients with all types of painful conditions. So that could be neck pain, back pain, even abdominal pain, headaches. We see patients with really any type of painful condition. We're willing to, at least see and give a consultation. And very often, if that patient has something significant, it might require multiple specialists. So, for instance, my patients with headache often also see a neurologist also.
Right. And I know, would Botox injections, I was thinking about with migraines.
Yes.
Is that something that you provide as well?
We do. We provide Botox for chronic migraine is usually the on-label indication for that. And frankly, we've seen great results in patients who have just any type of chronic headache, particularly a post-traumatic headache also.
Okay, very good. What if someone has generalized pain, like it's all over?
Yes, yeah.
Is there things that you can do with people who have that type of presentation?
Yeah, so if people have generalized pain all over, we would probably try to understand what that is, right? Does the patient have fibromyalgia, which is a relatively common condition where people might have multiple areas of pain or kind of all over chronic body pain? Or maybe the person has a rheumatologic condition like rheumatoid arthritis or another inflammatory condition. It's possible that the patient doesn't know. They've never been diagnosed with that, but they're not sure that they don't have it. So we will often initiate a workup, maybe order some labs to help rule in or out that type of condition. Mm-hmm. Excuse me. And then maybe also refer to a rheumatologist for a more full evaluation to add to that if there are concerns ongoing for that. Or sometimes for that patient with fibromyalgia, while the testing for that really involves mostly kind of some tender points and some history, the updated criteria. There's not any lab result that's required to get diagnosed with that. At the same time, sometimes we'll refer patients maybe for a second opinion from a rheumatologist just to confirm that that's their best assessment too, and that we're not missing anything.
Right. And two, I think people don't realize just because someone does have the diagnosis of fibromyalgia, they can also have something that could be treated by, a steroid injection or, they can have more than one source of pain. So that does happen. I have had patients that have been very wary. You talk to them about epidural, like, oh no, I don't want to get paralyzed. They're very fearful. Could you explain, are those fears warranted? Or they shouldn't worry about those kind of things? What are the things people should be aware?
Yeah, I think for patients, especially for patients that might have had ongoing chronic pain, it may be important to consider new avenues and maintain an open mind to possibilities of new treatments. Because frankly, just like that unwillingness to try or unwillingness, and whether it's an epidural or physical therapy or a dietary change, that like being a little boxed in and unwilling to try something new may be negative for the patient and can be part of just how one starts to think about their own disease process or what's going on with them. So a lot of times we'll try to kind of explore that and work with patients to see if they might be open to certain things. On the other hand, I think it's really important that patients need to be bought in when, say, if I propose an epidural or an injection is appropriate medically for a person who has a bulging disc or narrowing in their spine. It's really important that the patient feels comfortable with it. It's really important to me because it's, of course, they need to consent and, give appropriate informed consent for the procedure. And then also they need to have a certain amount of, faith and comfortability with the procedure and that it will work for them. So are those fears warranted that, if you have a patient, say, maybe with fibromyalgia, but perhaps they also have a bulging disc in the neck that seems to be causing narrowing that is associated with maybe a radicular symptom, which would be like radiating pain in an extremity like the arm. Yes, there are risks of injections, including epidural injections. They are small. They are not zero. So it's just part of the process of that, I guess, really informed consent for the procedure to talk through all that with patients. We're always going to make sure that we feel like the benefits or the potential benefits outweigh the risks. So we need to have, if we're proposing an injection medically, right, me as a doctor, I need to feel like, hey, there's a significant chance this may help. And while there are some non-zero risks, I don't think they're things that we're likely to run into. Personally, knock on wood, I haven't had any paralysis events related to epidural injections. And so I think, we do our procedures under X-ray guidance.
Right.
And so there are ways that we can make a procedure like an epidural less risky. And that's one of the ways. And then just experience, just having done, hundreds, if not, getting into over 1,000, certainly in my career at this point, hundreds, if not thousands of procedures safely and with good results, then we, feel confident, I feel confident in my own abilities to give a safe and appropriate injection.
Okay, great. And you're in Maryland. I forgot to mention that. What city in Maryland?
We're in Bowie, which is kind of between DC and Annapolis.
Okay, all right. I have another question. I feel like pain management, it's not a dying breed because it's very prevalent, right? But I've just seen so many, I hear of people closing, patients say, oh, my pain management doctor's not there anymore. that seems to be frequent. What do you do with someone who all they want is their opioids? They take 3 times a day, maybe. They're not interested in any other interventions. Can someone who has needs maintenance for their pain management, can they see you for that, or that's not something that you do?
Those are patients that we treat, absolutely. Yeah, and in fact, the updated CDC guidelines for 2022 have really clarified that patients who are on an established opioid regimen, who are, by your best assessment as a doctor, taking the medication appropriately and, not showing signs of misuse or abuse, that it's reasonable to continue prescribing in those cases. And there's a lot that goes into that assessment, but certainly there's not a blanket mandate to wean everybody off of opioids in the updated CDC guidelines for 2022.
Right, and I'm sure you have pain agreements for people and that kind of thing.
We do.
Yeah,
we do. Yeah.
Yeah, it's not that I'm not comfortable with opioids. I am, but sometimes I don't do it in the right order, and then I get in trouble. So just to say, like
Right.
like someone I'm referring right now, who was like, "Oh shucks, I just assumed, and I didn't start with the pain agreement, and yeah, it's kind of
Yeah.
not the right way to right the way to do it."
Yeah, we tend to kind of have that on the front end with our intake paperwork, and in fact, sometimes we'll get pushback because say I see a new patient and there's this, opioid agreement in the paperwork, and they'll say, "Well, I don't know if I want to treat with you," or
Mm.
I'm not going to take an opioid, so why would I sign an opioid agreement? So
Oh, okay.
we do tend to, you can kind of default to one or the other. We tend to default to giving it out too often, and then sometimes patients will just say, "Hey, I don't want to sign this," and that's
Mhm.
fine. But the patients that we're going to prescribe for need to have an opioid agreement.
Right, right. Understood. Okay, is there anything before we finish up that you'd like our audience to hear? I'm really, really grateful that you're able to do this today. It was
Yeah,
good.
I would love to. Yeah, I'd love to do it again. We could talk about, any specific procedures that people had questions about. I suppose if we get, views or comments, make a comment about a procedure you'd like to hear about or with questions, I think that would be great. Yeah, I just love opportunity to let people know about our services at Lifestream Health. We treat acute and chronic pain and with medications, injections, referrals, physical therapy, and all of that. We want to be the comprehensive resource for all of this in our area.
Awesome, awesome. And how would anyone reach you that is wanting to know more, have questions, want to work
Yes,
with
that is a
you?
key question. Our website is www.lifestreamhealth.com. And I believe there is some contact us opportunity on the website. Those things will email me actually, and I will pass them along. You can also call the office at 301-860-0305. And there's a prompt for new patients. And so if you were looking to possibly initiate care, you could call, say you were a new patient, and follow the instructions. It would prompt you to speak with someone to try to make an appointment.
Awesome, awesome. Well, again, Dr. Merritt, thank you so much for being with my audience today, and I really appreciate what you do. It's
Yeah,
important. A lot of
I
people.
appreciate it. Yeah, no, and it's so important what you do. I'm excited for the potential for coaching for patients with chronic pain.
Oh, thanks, thanks. All right, peace and blessings, everyone. Bye.
Thank you. Bye.